Hey guys, it's Felicia with Philly Tea and Medicine. We're back again with another video. So today is Tuesday, December the 1st, and your girl has literally just walked in from her OBGYN service, but I had to catch you guys up because I have not talked to you in about 2 months. I've been MIA. I finished my general surgery rotation, followed up with my surgery subspecialty rotation. Surgery rotation was for 4 weeks. My surgery subspecialty, I had 2. Each of them were 2 weeks long. I had ENT first, ears, nose, and throat, followed with my urology service. Overall, I must say that my general surgery rotation was pretty good. Now, I'm really surprised because in the beginning, if you asked me if I wanted to do this surgery rotation, I would have told you no. I was very apprehensive just because if I'm going to give you the tea on medical school and everything in between, surgery can be very brutal. The hours can be extremely long. The culture can be super intense, and I didn't really want any parts, to be honest. However, this rotation exceeded my expectation, and I feel like my attendings really contributed to my experience. They were kind, they were assertive, they were about their business, they were willing to teach, and it was just overall a wonderful experience, and I was really able to immerse myself and see if I would enjoy surgery after all. Now, my typical day would start at 7 a.m. and I would end about 4 p.m. That was very unique in comparison to some of my colleagues who would have about 5 a.m. starts, and their days would end about 7, 8 different times. However, my attendings just did not keep me there that long. I would also say that a unique aspect of my rotation was that I was able to not only see general surgery cases, but my attending, he had 2 partners. The goal was for me to get in as many cases as I could with them. However, I did have the freedom or the flexibility to look at the OR schedule for the day or the next day and see what other cases I may want to participate in, scrub in. And so with that, I was able to see a lot of different cases. I was able to work with different services such as OB-GYN, urology, plastic surgery, as well as vascular surgery. So that was a great experience just because I had the opportunity to work with different services. Also, just the culture of the OR, you want to make sure that you try to get to the OR about 15 to 20 minutes before the surgery is going to start, depending on how fast you're able to scrub. Also, it gives you an opportunity if you are going into a case with an attending that maybe you have not met before, to introduce yourself, ask if it's okay if you can scrub in on that case with them and assist if possible, as well as introducing yourself to the surgical tech and the circulatory nurse so that you can give them your gowns, you can give them your glove sizes, and also ask if you're able to assist with positioning or getting the patient ready for that particular procedure. Oftentimes the nurses are gonna tell you no, they're fine, but it still shows your willingness to help and assist. So that was great. Some cool cases that I was able to see on that service, I would say, is on my urology cases. I was able to see certain prostatectomies, and this was on my general service when I rotated with the urologist. I also was able to see a nipple tattooing, which was pretty cool. You had a patient who had a breast augmentation, but then there was some hypopigmentation noted on the nipple, and so the surgeon was able to follow up with that. Also, minor procedures, I was able to see a basal cell carcinoma be removed, so that was pretty interesting. That can be very common at times, especially in sun exposed areas. Another cool surgery that I was able to assist in was a carotid endarterectomy with the vascular surgeon, and pretty much there is a stenosis or a narrowing in the carotid vessel, and so in a procedure the whole point was to remove this plaque out of the carotid artery to regain better flow, because circulation is important. After my 4 weeks, so I said my days were pretty much 7 a.m. to 4 p.m. Sometimes I left a little earlier than that, depending on if all the cases were completed. And I then transitioned into my ENT rotation. That was for 2 weeks. My typical day started about 8 a.m. I would finish about 4 p.m. And I would say primarily with that experience, I pretty much was in the office with my attending. He was very cool. And surprisingly, I was seeing a lot of high yield cases or information that I was actually reading about in the office. So that was very complimentary to my learning and my studying. I was able to participate with him in 2 surgeries that he had. It was a low volume that week, but we did do a septoplasty, which was pretty much a patient who had a deviated septum, which was resulting in nasal obstruction, causing the patient some difficulty breathing. Obviously, there were some interventions that were tried prior to the surgery, but ultimately it was time to do surgery. So that was an interesting procedure. I then went on to do my urology rotation, which lasted again for 2 weeks. That rotation, I really enjoyed that rotation. But what was interesting with that rotation is that it was more strenuous than my general surgery rotation. My hours for urology would start about 6 a.m. arrival time so that I can round with the residents. I'll talk a little bit more about that. And then my days would end typically around 6. Now, another unique aspect of that rotation is that that was the first time I would say I was really working consistently with residents. My other rotations, maybe once or twice I might be with the resident, but not so much. But being able to work with residents, I would say, was very, very helpful to me. I found that, and this can vary depending on the residents that you're working with and their willingness to teach you. But I found with these residents, they were very eager to help me, teach me. If I asked questions, they helped, as well as working with residents. What I noticed in comparison to attendings is that these people are a little closer to you. They're more of your peer age. They have some interesting ways on how to remember how to do an exam, mnemonics, things that your attendings, they're more distant from that stage of learning. So I think it added to my learning. Also, I think with working with residents, you are having a stronger idea of what it's like to be a resident, what it entails, as well as you're kind of at their will on when they're letting you go. And so, I just never knew when my day was going to end, as well as, like I said, I think the biggest take-home message for me was how they added to my learning, as well as seeing what it would be like to be a resident. So how our days would go is that we would start at about 6 a.m. meetup, and we would go see our patients that maybe we did surgeries on the day before. So this was rounding. We would attend to any consults that may have come in, maybe late on that night, and we would see on that morning. Another cool thing that was really great about my residents is that they really tried to eat together and really try to be close. So we would round on the patients, and then we would have breakfast together, and then we would start our day and do surgeries, and then lunch, we would grab lunch together. So that was really cool, and it also gives you an insight on how those residents interact and what that community is like. We would consult, like I said, and then we would also look at our list, and typically they were doing about 6 surgeries a day. Some procedures were quick. Some procedures were a little longer. Technically, those would be like our laparoscopic procedures or robotic cases. Robotic cases can be very long just because of the setup time to get the robot in alignment with the patient, all that stuff. So I also want to talk about how I prepped for my exams. So my shelf exam, I just had it 2 Fridays ago. One cool resource that I use every day pretty much on the ward is this book, Surgical Recall. I found that this book was very, very helpful on general surgery. It was very good in helping you identifying or knowing the key structures that you would see, that you might encounter under surgery. So in case your attendings ask you, you would be able to know. Also, a lot of just random facts. A lot of history on general surgery was also noted in this book. And interesting enough, there's a lot of history in surgery. So that was pretty helpful, I would say. In regards to my ENT service, I use this book a lot for that rotation. I read the entire section on ENT. And like I said, a lot of the information that I read that was high yield that was supposed to get me ready for boards and for my shelf exam, I was actually being able to see it in the office. So that was super, super cool. Again, high yield videos is what I watched on YouTube about general surgery. And lastly, completing all my questions on my QBank. So I must say that shelf exam, aka my COMAT exam, was stressful. I kept me on my toes. So we shall see how I did. I'm excited. Keep your girl in prayer. But overall, like I said, general surgery was a super, super cool experience. I must say, like, being gowned was a great experience. Hey guys, so I just want to add this insert. So like I said, and I want you guys to, learn from certain things that I've gone through, is keeping an open mind. Always keep an open mind. Like I said in this video, I had no interest in general surgery. I had no interest in doing this rotation just because I heard things about it, and I just, I like to keep an open mind, but I just was not super, super excited about the rotation. And I will say that being in the environment that I was really allowed me to just be fully immersed into it, and I enjoyed it, and it was great, and I thought it was super, super cool. And something a friend shared with me, because she is a surgeon, is that she just wanted me to experience the rotation because it is a cool rotation. And another thing, try to go on all these rotations with a very, very open mind, even if you don't want to do it, because one, you will never have this opportunity again. Like, you will never be able to practice within this field unless you pick it as your specialty. So you can say that you were a psychiatrist, you were a pediatrician, you were an OBGYN, you were a general surgery for that 4 months. For that month, I should say, or 4 weeks. Another thing is you can learn a lot from different rotations that will add to how you can become a stronger physician, because you will know all that high yield information or the best way to manage certain aspects of medicine, and you can add it to your repertoire, and you will know better how to manage this patient, how to manage this condition, and when to refer out. So I have a different approach in comparison to some of my colleagues. When attendings ask me what I am interested in, I tell them what I'm interested in. Sometimes it's not in that specialty. However, it's always good to be tactful. I say it in a way that is still saying, hey, I know I'm interested in this field. However, I still want to, learn about the high yield information, or learn about the most critical cases or conditions that you feel like, as this type of provider, I would be able to manage or help. And then sometimes you might have to circle back. Urology, they asked me if I was interested, and I was like, no, I'm not interested in urology. However, within 5 days, my interest grew. I thought it was interesting, and I was able to circle back to the program director like, hey, it's kind of interesting, and so being open-minded, being clear in your communication, I think will take you a very long way, and always being engaged and motivated. So even if you're not interested in a specialty, it's okay, but still show that you are interested and you are willing to fully learn everything that they have to offer you on that rotation, and your attendings will respect you for your honesty, and I think they will still be willing to teach if you're showing that interest. So thank you so much for watching this video. Your girl is tired and I got studying to do, but I had to catch you up, and like I said, and I will always tell you, thank you so much for watching my videos, and tell a friend to do what? Subscribe and watch Philly Tea and Medicine. Duh. Thanks.